All right, I think we can get started. If the OCI folks, Kelsey or Derek, can help me admit people as they come in, that would be great. All right, so thank you for joining us at our quarterly DHS OCI Healthcare Coverage Partnership Forum, a longer title than it used to be. So I know that there are quite a few new people that are on today's meeting. I know I got some email requests for information before this to make sure that everyone could engage as well as they could on this meeting. And we're really glad to have you and hope that this is an educational opportunity, but also a way for you to provide your feedback and insight to us. And so I'll just give a little introduction to what this partnership is about for those of you who are maybe new to this and haven't been on before. So in June of 2019, Governor Evers started the OCI DHS Healthcare Coverage Partnership. It was originally called the Advisory Council at the time. And the idea was to create a public-private partnership that would help increase collaboration between stakeholders, so across state agencies to enrollment groups and navigators and other stakeholders that serve different populations of people that we need to get enrolled in health coverage. It was also intended to help us identify some of the obstacles that exist for getting more people enrolled and inform the agency practices with that kind of on the ground feedback so that we can do the best that we can to get more and more people enrolled and shrink our uninsured population here in Wisconsin. So this partnership has been really successful in developing online resources and outreach tools, evaluating the workforce that we have available, reducing barriers to expanding that workforce, helping us understand the data gaps that we have so that we can do this work as well as we can. And a lot of that work has come from our 4 work groups. And so each one of these work groups will have an opportunity to give us a report throughout the meeting. But just as an overview, we have 4 work groups within this partnership. So we have the Outreach and Education Work Group, Data and Evaluation, Marketing and Promotion, and Workforce Capacity. So again, those folks give you more detail on exactly what they do when they get into their report outs. But breaking our work down into those work groups has been a really big part of our success. So in addition to coming to this forum, those of you that are kind of on this email list have signed up and wanted to join today to learn more about our healthcare coverage enrollment efforts. You're also more than welcome to reach out if there's a particular work group that you have an area of expertise in or something that you think you'd like to add value to, participate in. You know, we are always looking for help and assistance in all those work groups to make sure that we are getting the best results from all of their efforts as we possibly can. So that is all I'm going to do for the introduction of the partnership overall. I will just give a quick kind of, I know we've all done these Zoom meetings for a very long time, but quick structure for the meeting. So if all of the participants could just remain muted while we are getting different updates and work group report outs, we have a pretty significant opportunity for discussion at the end. There may also be some work group chairs who, when they give their report outs, have a specific prompt or question that they would like input on. And at that time, you are welcome to put a question or comment in the chat, and then I may ask you to unmute at that point, just because we're nearing about 50 people on the meeting, so I don't want to have several people unmute at the same time and try to speak. So I think using the chat is going to be the easiest way to make sure that all of you can share your thoughts or ask any questions you might have, and we'll be happy to answer them as we go. And also, we'd love to get your thoughts and feedback and questions during our longer discussion period toward the end of the agenda today. So the first section of the agenda we'll get into right away is from agencies. Each one of us that are kind of the agency heads of this partnership will provide a quick update. And I am first going to go to Jim Jones, the Medicaid Director at the Department of Health Services, to give us an update on the public health emergency unwinding. So Jim, you want to take it away?
Thank you so much, Sarah. And thanks everybody for being here today. A couple of things, just so you know about the public health emergency unwinding, what that is, what does it mean? During the pandemic, the Department of Health and Human Services declared a public health emergency associated with the COVID-19 pandemic. One of the things that occurred after the pandemic was rampant across the whole state and the whole country is a public health emergency was declared, and Congress acted and created the Family First Coronavirus Response Act, FICRA, as they call it euphemistically. What we saw then as part of that legislation, and with some updates from the CARES Act that came right after it, is that states could receive an additional 6.2% in federal funding associated with the Medicaid program, so long as they met certain criteria. Those criteria were really two pieces. One, states were not allowed to discontinue or terminate Medicaid eligibility or CHIP eligibility, actually, for anyone on the program as of the date that the act passed, which was in March of 2020. Additionally, states who had implemented any new policies after January 1st of 2020 could not continue those policies. They had to back that up if those policies were more restrictive than they had been before January 1st, 2020. So Wisconsin did all those things. We have continued Medicaid for everyone on the program since March and April of 2020. We have not required people to do renewals. Whenever they report changes, those are not affecting their eligibility. The only people who have lost eligibility during this time are 1, individuals who've left the state of Wisconsin, 2, individuals who voluntarily withdrew from the program, and number 3, unfortunately for some people, they passed away and we could no longer continue their eligibility beyond that date. So those are the only people that we've actually determined to be disabled. We also, when it came to more restrictive policies, we had put policies in effect for the Medicaid Purchase Plan program associated with premiums and work requirements. And we'd also put in place some Badger Care reform changes associated with premiums for childless adults. We had to roll those both back. And we have continued on without those policies throughout the duration of the pandemic. When the public health emergency ends, states will have gotten some guidance from CMS about what we're supposed to do. When it ends, at the end of that corner, we'll stop receiving the additional federal funding. And we must, at that particular point, begin to unwind that public health emergency requirement of keeping people eligible. CMS has given states the guidance that they have 12 months after the public health emergency ends to complete a renewal for each and every case in Medicaid before terminating any coverage. That means that even if people had reported that they were ineligible and perhaps their income went up, in those instances, we cannot determine them ineligible and terminate coverage. We must complete a complete renewal for them. After we've received that guidance, the Wisconsin Department of Health Services, where I work, we began working on a plan for the public health emergency unwinding. As such, as we're doing that, we're working on that plan right now about how do we do renewals, what's the order that we're going to do those renewals, et cetera. We had assumed it when we started this process that the public health emergency might end at the end of this year. That was the best information we had. Fortunately for all of us, the Department of Health and Human Services Secretary, Becerra, actually extended the public health emergency until January 16th. We are unsure if it will be extended beyond that date, but we have begun our planning for how we will do this. We have decided that we will do it over the course of 12 months. I should know other states are trying to do it faster, but we will also, the idea here is we want to maintain coverage for everyone who remains eligible for the Medicaid program and help them through the process of their renewal. And those individuals who are no longer eligible because of income, household composition, or another reason, we want to make sure that they have access to coverage either through the federally facilitated marketplace or through employer-sponsored insurance or through some other means. So we want to help them through that transition. We will be in the coming month beginning to put together an external stakeholders group where we will work with Covering Wisconsin, with the people on this call, the partnership. We will also be working with our managed care partners, with the Wisconsin Primary Healthcare Association, Disability Rights of Wisconsin, et cetera. So as we're doing all of those things, we urge anyone who's interested in participating to let us know. We will be holding forums in which we will talk through the steps that we will be taking, what order we will put these particular case renewals in place. So that's where we are at this particular point in the process. And while we have begun doing a lot of thinking, a lot of planning around this, I don't have any very specific news to share at this particular point, but in the coming months, we will be sharing all of our updates. So that's all I had to say today, Sarah. I will turn it back over to you.
Great, thank you. Well, are there any questions on that update on what DHS is doing around the public health emergency unwinding plan at this point? Again, you can put any questions or comments in the chat, and I may ask you to unmute if we need further information, but I don't see anything coming in. There is a discussion period again, like I said at the end. So also for the folks who've joined recently, feel free to share any questions, comments, and feedback. This is supposed to be a kind of two-way street. We'd love to get your insights during this meeting, during the discussion period near the end. So now I will provide our agency update. I'm Sarah Smith, the Director of Public Affairs with the Office of the Commissioner of Insurance. And our main update today is just going to be one thing, our state flexibility grant. So we were awarded a state flexibility grant through the federal government earlier this fall. It was a little bit delayed. Originally, we had hoped we would be able to use it for this enrollment period, but now we have adjusted our timelines to plan for the kind of 2023 open enrollment period and making it as effective as we can to utilize these funds. So as you can see here, this flexibility grant is for about $689,000. It is, well, again, it was awarded earlier this fall, so September 15th, and it goes through September 15th or September 14th of 2023. So this grant is going to do sort of two things with for OCI. We've broken it down into two buckets that we'd like to use these funds for to help us further our enrollment efforts to expand healthcare coverage in Wisconsin. So one of the first things is doing a market analysis. So this is going to include three components. It's going to be an analysis of ACA compliant plans and the uninsured population. There's going to be an analysis of short-term limited duration plans and one on network adequacy and providers. So this is going to give us kind of an overall snapshot of our state enrollment plans, the ways that people are utilizing different types of plans, particularly from like the short-term limited duration angle, and understanding the uninsured consumers across the state. So we are hoping that this will help us understand a little bit better why certain consumers forego getting health insurance coverage, what future enrollment projections may look like, the extent that navigator and assister resources are known throughout the state, and really just help us understand geographically where folks are located that are uninsured and which messages might be, best to get through to them if they are people who are getting enrolled on short-term limited duration plans or not getting enrolled at all and didn't know there was a navigator resource or those sorts of things, to start identifying exactly what those gaps are in different parts of the state across different populations so we can get people enrolled in the best plan for them. So part of that is then going to inform the second half of this state flexibility grant funding, which will be a marketing plan. So this is, like I said, we were originally going to use this funding for this fall's open enrollment period, but now we're going to utilize the information we gain from the market analysis, and we're going to do the marketing plan based on the information we learn from that analysis. And so then we'll be able to develop a statewide strategy for the 2023 open enrollment period next fall. So one of the things that we'd be looking for is, based on the information we find in this market analysis, whether it would be best for OCI to use these funds for a public relations firm to help us develop a statewide strategy, develop messaging, understand exactly what consumers, what messages are going to work for consumers or not, things like that. Or utilize the funds to do an ad buy, media buys, and really just put more force behind the information we already have and all the resources we already have. If we know that those are effective and those are meeting the needs of consumers, they're just not reaching every corner of the state and getting into every community. So that's going to be the second piece that we will base on what we find out in the market analysis. So the market analysis is going to be determined by an RFP process. We may be putting that out as early as next week, but that is still in process. So if anybody is interested in more details about this or in the market analysis, please let me know. But that's the update from OCI. Are there any questions from anybody or comments in the chat? Don't see anything. All right. And we can go ahead into our work group reports. So the first one here, I'm going to hand it to Bobby to give us the work group report from the workforce capacity group.
Thank you, Stephanie. And I'll just ask you to advance the slide, please. So my name is Bobby Peterson, Executive Director, Public Interest Attorney at ABC for Health. And I've been helping to lead the workforce capacity and consumer assistance work group. These are some of the participants. We actually have a couple more that I didn't include on the list. Unfortunately, a couple of managed care organizations. I'll be updating this list, but we're really looking at trying to have a good cross-section of folks to provide input to some of the activities that we're involved in around systems building. There's some immediate term needs for outreach, enrollment, and marketing, and then there's also long-term planning and development that we've been working on for a while to think about how do we build sustainable systems of consumer assistance and workforce training. So the guiding principles that we're working under were provided by Governor Evers, Executive Order number 3, and I think he laid out some pretty important markers for us to think about in directing DHS about increasing healthcare coverage, improving access, investing in prevention and wellness, looking at a robust, diverse workforce, innovation, and reducing health disparities. And I think as we go through some of the overarching goals that the work group has put forward, I think you'll see that we touch on many of these items. Next slide. So the first recommendation is thinking about a virtual consumer assistance hub. And this is something I think for the long-term sustainability, we need to think more than just from open enrollment to crisis to crisis. How are we going to create a sustainable system in Wisconsin that we all can be proud of, that provides comprehensive statewide assistance? I think we've learned a lot during the public health emergency and during COVID about how we can do certain things well virtually. Other things you still need to have as much hands-on activity as possible. But I think a virtual consumer assistance hub that connects key agencies across the state, key resources. We're not trying to reinvent the wheel, and we spent a lot of time building a resources matrix and looking at who's providing assistance where, at what level of assistance, thinking about not everyone needs the advanced expert on some of this stuff. It might be just outreach and mobilizer type activities, but thinking about that continuum of service in a consumer assistance hub, and really thinking about ways that we can get people to the right place at the right time. And that's really important. We talked quite a bit about how this would be a hub that focuses on access to healthcare coverage and care. And so it could be a clearinghouse that directs people to the right folks to talk to, with training using decision support technology, using tools that are in place now, like the connector tool, making sure we get people to the right place. But we want to make sure that we create a more seamless system. We know there are gaps in there from our review and research. We want to make sure that we're paying very close attention to disparity populations and thinking about ways to make sure that they stay connected. DHS and Nick DeMeo did a very good report a couple of years ago, a churn report that showed a lot of people were losing coverage. And I think we really can learn from that and think about ways to keep people connected, both to Medicaid and Marketplace. And we know that, there's an impending storm ahead and all hands on deck to help address it, but that 175 to 2,000 Medicaid enrollees face transitions as the public health emergency, is going to end at some point, we assume. Well, we never can say that with certainty, but as that transition occurs, we really have the goal is to make sure that everyone gets connected to the right place at the right time and maintains continuity of healthcare coverage and services. It's very important, and I think it's something that's achievable with the type of folks we have in the work group and as a part of this partnership. Next slide. So the other part of this then is, as we think about a statewide virtual hub, which is really important and a long-term sustainable goal to create and develop, we need to make sure that we have a competent workforce to provide the services, and that's developing virtual workforce training portal. And it's really, I think, something that we do have some component pieces already. We have training that Covering Wisconsin provides. We have things like the DHS Learning Center that does a lot of training for new economic support workers. We do training at ABC for Health and Health Watch. There's training that's going on. We just need to help connect the dots and create a stronger systemic portal that's going to support workers at the same sort of levels of basic, intermediate, and advanced. Issue spotters, making sure we get people connected to the right resources and the level of complexity that they're going to need. Again, this is thinking longer term. This is thinking about supporting a sustainable and virtual workforce training portal that will connect the dots in the state of Wisconsin, and something that can be here for a long time to help support the workforce with continuing education, new and emerging changes to programs, things like the public health emergency ending. How is that going to affect and impact, and having really state-of-the-art communication support and training and learning that it's not just a handbook, but also includes video and fact sheets and a variety of learning methods to help people stay up to speed on some of these things. Next slide. I think that's it for me, and I think this is Allison. You're muted, Allison.
Yep, got that. Thank you, Bobby. And yes, I'm just going to take this opportunity. So Bobby talked very well about some of the longer term goals of this workforce work group. I wanted to take this opportunity to share just the status of the Navigator expansion that has happened just recently with the influx of federal funding to Wisconsin. So Covering Wisconsin received those funds earlier this fall. And we've been, and the map that you see in front of you, which I understand is probably a little small, we will be sharing this out through Covering Wisconsin in the coming days, so you can have it more in front of you. But I did want to share this. Just what this shows is a better geographic representation that we've been able to achieve, and that we are continuing to work on with these funds. And what you see is that Navigator funds have been able to support navigators around the state. I think it's a total of 21 FTE, which includes, I believe, at least 28 individuals. So most of them are half-time to full-time, which is really what is needed to help support people year-round, not just during open enrollment. But these are the agencies, so it's Covering Wisconsin, as well as those that are represented here. So ABC for Rural Health, Northwest SEP, which also further subcontracts with additional 2 agencies in the state, Family Health Centers of Marshfield Clinic, WIPS, which was Wisconsin Institute for Public Policy and Service, Partnership Community Health Center, Centro Hispano of Dane County, Progressive Community Health Center, Gerald L. Ignace Indian Health Center, and I believe that is all. I hope I haven't missed anybody, but I just wanted to share that out. And like I said, more will be coming in the coming days, just to make sure that people are aware of where these navigators are available. Navigators can support anyone in the state. They don't have to be in their geographic area, but we do know that locality matters. Included in these navigators are also an expansion of bilingual support. So we have both 3 navigators who are Hmong bilingual, as well as 4 Spanish bilingual navigators. Next slide. And this is also, just as Bobby mentioned, just a reminder of how folks can currently get access to these navigators and find where they're located. There is the connector tool, which is on the Covering Wisconsin website, but it is a widget that anybody can put on their website. If that's something of interest to you, please do reach out. We have that you can just put in the zip code. You can also, there are some appointment scheduling options directly on the tool. Most of our promotions and most of the promotions that the promotions and marketing team work group has put together also reference Wisconsin 211, which I'm sure many of you are very well familiar with. It's an easy number to remember. So instead of trying to put a long phone number that people have to quickly digest and remember, 211, just call them with funding with both from the state and federal navigator funds. We have further subcontracted with them to help provide warm transfer. So if somebody calls, they can get directly connected to an enrollment assister as opposed to being given a phone number that they further need to call. And then of course, wiscover.com, which has also been a product of this partnership that OCI is hosting. Again, people can go there, look for information, not only on navigators, but all sorts of health coverage resources. And then there's this federal CMS Find Local Help tool. And so next slide. And this is just an image of Wiscovered. So that's all I wanted to share. Thank you very much.
Thank you, Allison. All right. We do have one just final step from Bobby. I don't know if you have anything you wanted to add on this, Bobby. But we will then jump into the data work group and I will hand it over to Melissa.
Thanks, Sarah. So since we only meet quarterly, I'll just do a really quick reminder of the focus of the data work group, which can really be categorized into 3 buckets. The first bucket is making the data we have more accessible for stakeholders who are working to get people covered and keep them covered. And we're hyper aware that a lot of the data that is available to us falls under the umbrella of census data, which is difficult to navigate for the average person. So the data work group is working to take that data, pair it with state data when that's possible, and then make everything more accessible and easier to understand. We're also trying to identify and fill gaps. And there's a couple examples from the past year of our work group's work to include, like, for example, more timely information about enrollment on the individual marketplace, which was missing and now OCI is collecting. And then trying to get to some deeper information specific to our state as to why people make the coverage choices they do. And we're hoping that that could be revealed to some degree in OCI's market analysis that Sarah talked about earlier. And then the third bucket is displaying data that's going to help us track progress toward our goals and then identify potential problems so they can be addressed sooner. So those 3 buckets are really what the data work group, kind of like all of our work, encompasses that. And they're very much at work in the recommendations we put forward to the partnership as we approach the upcoming open enrollment period, which will be directly followed by the PHE unwinding. And so in our read ahead materials, I've shared a summary of our recommendations and would love to get feedback from any stakeholder on the call today on these recommendations that we've made. If you could move to the next slide, Sarah. These next two slides summarize some of the visualizations we're envisioning to go along with those recommendations. So I'm going to really quickly talk through this. These are models that DHS, OCI, and others on our work group have been discussing, but please remember they're models only. They're not at all final, and there's no real data in here. So the end product is going to look very different. But this first one that shows the map is how we think we might be able to help people navigate county by county data that we feel is really important to help stakeholders understand where to focus resources so we can help the most people. So imagine this being a heat map that shows Medicaid renewals in advance, along with whatever demographic data we might have to inform outreach efforts. The second visual, which is right on that same slide, is intended to track renewal completion rates by county compared against a goal. And so we would think about, visualizing this for 30 days and 90 days. So that's just another example. And then on the next slide, we have a third one that would compare Medicaid closures against corresponding increases in individual and group coverage, which OCI is now collecting from insurers on a monthly basis. I think, I don't know if you can advance the slide, Sarah. There we go. So we would at least have an idea, although I'm going to admit an imperfect one, about how the end of the PHE unwinding is unfolding and where people are able to find other coverage or not find other coverage, which we would want to know sooner rather than later. And then finally, and this isn't modeled on the slides, but we're working on other visualizations that would include, but isn't limited to, tracking referrals to the FFM and those received from the FFM and some other important data points that stakeholders have communicated to us are very important to them. On the next slide, Sarah, I noted a couple of very high level next steps. We're actively working with DHS and OCI and getting data together for reporting and aligning our priorities, which will then help us collaboratively refine these data models that I've shown today. And, I think one need that we have been missing for quite a while is a Tableau resource. So if anyone has any suggestions who is on the phone, we'd love to hear about that. And I know I've given you a lot of detail in a short amount of time, but happy to answer any questions, take any feedback. If you have those, please email me. I will put my email in the chat if I can, and then you can get a hold of me that way. Thank you.
Thanks, Melissa. So I don't see anything in the chat. If anybody has any questions, again, feel free to throw things in here as we're talking. If there is a data point you think would be helpful for your group to know about, or from the workforce capacity, if you have ideas that would be helpful, you can throw them in here and we will make sure we discuss that during the discussion period later. So then we are going to jump into the marketing work group. And I think I am first handing it to Stephanie. And I know she had a little issue connecting. Are you on, Stephanie?
I hope you can hear me. Thank you.
Yes, I can hear you and see you. Perfect.
Yeah, I had to resort to an old laptop. Hello, everyone. So I wanted to just start with the marketing work group has been working really hard since the summer, early summer, thinking about, okay, open enrollment's coming. What are our goals? What are we going to do? And so just to kind of walk you through that process, the overall idea is the marketing work group is we want to recognize the power of partners and the state, that we are all working together to co-create these key messages and strategies that ultimately inspire action amongst consumers around the state. So some of the things we've been specifically doing are co-creating messages, materials, and communication plans. And the idea is not just advertise healthcare.gov or open enrollment, but to cast a wider net and encourage both marketplace and Medicaid eligible consumers to sign up. And we realize and recognize that people don't know what they're eligible for. And often we just need to get them to step forward and inquire, or even go to healthcare.gov and be funneled to the appropriate channel, as there is no wrong door. And the other thing is that many agencies across the state have really recognized that open enrollment is a huge opportunity for people to sign up for Medicaid as well. So for example, covering Wisconsin, about a third of all people enrolled through a navigator are enrolled in Medicaid programs. So the other idea is we're working to establish a more coordinated marketing effort among stakeholders. You know, if we all send out different communications that are disjointed, and they're not going to help people really understand the whole perspective and potentially get to where they need to be to complete an enrollment or even inquire. We have talked a lot about a potential that we see to be challenging is with the extended open enrollment timetable. We lose urgency, and a lot of communications are most effective when people feel a sense of urgency, and we no longer have a deadline that's around the corner. So the deadline is very long. Most enrollments happen in the last 2 weeks of open enrollment. So we've been strategizing how to maintain some urgency and get people in the door before January, because we don't want everyone to sign up already after the beginning of the year. And the other thing we've been doing is looking to identify some additional audiences, such as those who are self-employed or looking to retire early. So one of the things that we started with was developing some key messages, and we worked together as a team to come up with some ideas. Covering Wisconsin was able to test in 2 different rounds of some of those messages in 2 different groups. The first one happened in Madison. There was about 5 participants. It was a inclusive audience of many different demographics in the Madison metropolitan area. And then the second one was co-conducted with Empower, who are a marketing firm in Milwaukee who specialize in reaching Black and Brown audiences, and particular zip codes and demographics, which I don't know the zip code off the top of my head. So, and what we found, and there was around 10 participants in that one. So what we found, and some, well, I'll just summarize. Often in former studies, it's been found that people don't even try to look or come to the marketplace because they assume it's too expensive, or maybe they looked once and it was too expensive. And so in past marketing, they found that a lot of messaging that was focused on the reduced cost was effective. However, the cost is so little now with all the additional money from the COVID relief funds, the American Rescue Plan Act, that when we're even telling them true data, 4 to 5 people can find a plan for $10 or less, people think that it's too good to be true. And they have a reaction of like, yeah, what kind of plan do you get for that? Or you get what you pay for. I heard janky plans. And so we discovered it was very important, if we're going to go with the cost, we have to identify why it's so cheap and give some real reasoning there. So one of the things we developed was a COVID stamp. We call it the COVID stamp, but I'll show you an example of it in a further slide. And also reinforce, what are the other things that you get with that cheap $10 plan? Well, maybe you also get some low deductibles and low copays. We noticed with the Milwaukee audience in particular, a confusion of the name. People said, well, do you mean Obamacare? Why don't you just say that? And of course, that's not always a popular way to characterize the Affordable Care Act. So we thought that was really interesting. Different audiences really view the name in different ways. And then people really gravitated to positive and targeted messages. So the time to take care of you was a very popular message amongst all audience and all demographics. Something else that was popular was financial help no matter what you earn. I don't think I actually put that one on the screen. And then people really liked the targeted messaging of, oh, no health insurance from your job or need health insurance, because they said, oh, well, that's me. And I really respond to that. That feels like it's talking directly to me and my needs. So, oh, I do have the financial help no matter what you earn. So yeah, I found that message really did well amongst all income groups, especially middle to low income groups, but really it performed well. The other thing we noticed, especially with the Milwaukee market, was people recognize that 2-in-1 is a resource. Yeah, I know we need 2-in-1. I call it when I have to, but I don't like to call it. So I thought that was an interesting reaction. 2-in-1 has done a lot of marketing of and brand recognition for 2-in-1 in the area. So people really know what it is. But for an outreach card, for example, if you're giving them a card, they would prefer a local number. Thank you. Some of the key messages that we kind of went towards that we thought these all performed well, and we're going to stick with some of these. I kind of think of it as like a hook and a message, but they can be intertwined, of course. It's time to take care of you. Health insurance prices are lower than ever. Need health insurance? No health insurance from your job? Does health insurance cost too much? That one also performed well in consumer testing. And we have not yet consumer tested the looking to retire early. No worries. So that's one of the new ones that hasn't yet been consumer tested. And then on the message side, financial help no matter what you earn. Again, the health insurance prices are lower than ever. Get help from an expert to find a better plan. 4 to 5 people find a plan for $10 or less, but with, again, that additional sort of information about how it's not a scam. So here's the example in the image of the COVID stamp. So COVID relief, new financial help for 2022 plans. And the language on that stamp, we had very different language when we first developed the stamp. And so this language here really represents what people were suggesting during the consumer focus group of what would draw their attention and what would be convincing and helpful for them. Okay, and then next slide. So once we have the key messages, then, we work together, the whole marketing group is very much a lot of different stakeholders coming to the table. And so both OCI and Covered Wisconsin were able to develop toolkits with different materials. We're going to go into that in a minute. And then we also work with the education group to encourage the key messages for them to take to their audiences and to funnel that through the CACs and navigators. And then we used a lot of what we learned for the creation of radio, TV, and social media ads. So I'll let Sarah, are you gonna present this, or Kelsey, or should I?
I would leave that up to you and Kelsey, but
Kelsey, do you wanna?
Sure, I'd be happy to. All right, so OCI has put together a digital media toolkit, which contains some social media messaging, the post text, and some graphics. And that's all translated into Spanish and Hmong as well. Then we've gone ahead and updated wiscovered.com already. So we've got almost all of the changes on there for open enrollment. There will be a couple of tweaks on the digital media toolkit as we wrap up the press release templates and the opening welcome letter as well this week. And then we're also working on some different videos. And the first video will be starting on November 1st, just as the overall kickoff video for open enrollment. Next slide. Then here's some samples of the social media graphics and the post The post text is just in a Word document, so you can download that and feel free to edit it as you see fit. In the toolkit, there's also some email signature graphics, flyers, and social media headers. And like I mentioned, the press release templates and the videos, we'll be adding those to WisCovered digital media toolkit page as they're wrapped up here. Next slide, please. Like I had mentioned, we've already got all of the content updated on WisCovered in English, Spanish, and Hmong, and visitors are encouraged to contact a health insurance expert if they need help applying for or renewing a plan, updating their healthcare.gov or Badger Care Plus information, completing their application with help from an expert, reviewing their plan. We also encourage them to learn more about the Medicare open enrollment. They can read frequently asked questions about open enrollment and access our digital media toolkit to share on their own pages.
Okay, and then the Covering Wisconsin toolkit has graphics in both English and Spanish. So we have 3 or 4 different sections where we have social media posts, that's just static posts, flyers, and then outreach cards. And then we have a section of actual videos that can be shared for social media or other things. And we have a assortment of things on there right now, but we're going to do another dump of we have only like 6 for each section, and we're going to do another 6 for each section. We've got them nearly ready to go. So just because we know we want to give people lots of different options. And oh, if you could go back to the last slide. So I will say today we just did a post, and if you go to the Covering Wisconsin site, you can see the scarecrow with the pumpkin. So it's scary to go without health insurance as our post for today. So we're very excited about it, and I'll talk more about that in a minute. Okay, so one of the things that this group has really invested our time to do, and we thought it was very worthwhile, is an ad by, well, it's actually public service announcement style of a public education program from the Wisconsin Broadcasters Association. So to give you an idea of what that means and what it does and how much of the market it reaches, I want to tell you about the one we did for the 2021 special enrollment period. So that was also a group effort. We write all the scripts and everything with the group, the marketing work group. We were able to get, with also funders chipping in, we got 6 weeks of promotional programming, and that was TV, radio, and social media. And that covered 95% of the Wisconsin markets. And then I want to do a shout out to the groups who supported that effort, because we really, really appreciate their support. So that was Common Ground, Anthem Blue Cross Blue Shield, Molina, together with CCHP and UW Health. Covering Wisconsin contributed funds from a grant we received from state of Wisconsin and Wisconsin Department of Health Services. So thank you to everyone who contributed. So that paid for over 6,800 radio ads on 173 stations throughout the state. And I do have a list of all of those radio stations if you're curious. We had almost 2,000 TV ads on 44 stations, and they also run on Hulu via the local channels. So our investment was $57,000, but it bought us about over $322,000 worth of ads. Their Nielsen data show a consumer reach, and I couldn't do a 6-week exactly, but for 1 month, it reaches over 1 million TV viewers and over 2.5 million for radio. And then as part of the package, we can also do pay for a social media part. So whatever we post, then all the different radio stations or TV stations who have active social media, Twitter and Facebook or either, then they post something on their sites as well. And that gives us a much larger reach for social media. And so with that particular campaign, we were able to reach nearly 500,000 Wisconsinites. And we had over 21,000 post engagements. So we want to do it again. We already have our videos ready. They're going to drop on November 1st. We'd really like to do 9 weeks to support this extended open enrollment period. Our current amount of support will pay for 4.5 weeks. And we've already had a few groups reach out to help us support this effort. So again, Common Ground, Healthcare Cooperative, Security Health Plan, and UW Health have matched funds from Covering Wisconsin. So other ways that you can support the campaign, and some of this will be talked about in more detail with the education group. So if you could follow OCI and Covering Wisconsin on Twitter and Facebook, both of our agencies post a lot of content during open enrollment. And so if you follow us, you can find whenever we're posting new content and repost and share and like, especially on Mondays at 9 a.m. Covering Wisconsin is really trying to get those posts that are going to be shared on the radio and TV stations to go viral. So nearly every Monday at 9 a.m. for the next 4.5, 5 weeks at this point, hopefully 9. And then print and share the outreach cards and flyers. And I just want to let you know there are some other agency-led promotions that complement all of what we're doing in the marketing group. So I know MCAN is planning a campaign. Part of what they'll be doing are some junior billboards and a lot of social media. Madison, we've got Covering Wisconsin's doing Madison bus placards. Centro Hispano is going to be doing some Spanish radio interviews. We're also going to be, Covering Wisconsin will be doing a lot of rural, local newspaper publications as we're working with some of our rural partners to try to reach some hard to reach audiences. Fox Valley has a whole campaign happening through Partnership Community Health Center. So there's other campaigns happening. But we recognize that, these are 3 of our largest metropolitan regions. And we have a whole other section of the state where the TV and radio, yeah, they'll reach it, but we need some more help. And we're hoping that the outreach and education work group can help give you some more strategies to share and spread with other partner agencies. Oh, and I'll put my contact information in the chat. So if you want to contribute or you just want to talk more or learn more, if you want to see what the TV ads are going to look like, I can share all that information.
Great, thank you, Stephanie. Right, and now we are going to jump to the outreach and education work group, and that will be Courtney.
Thanks, Sarah. Hi, everybody. I am Courtney Harris, and I am our chair of the Outreach and Education Committee. I'm fortunate to get to go at the end of our work group report outs because our Outreach and Education work group, probably pretty obviously now you can see how we work with the other work groups to take a lot of the tools and information that they develop to work with you all as community partners to spread the word about these enrollment opportunities locally. So I'm going to kind of take an opportunity to talk about what the Outreach and Education Work Group does and what we've been up to in the context of our two of our main priorities right now. The first, preparing for healthcare.gov open enrollment, and then also helping support consumers at the end of the public health emergency unwinding. So first, we are fortunate in our work group too to have a pretty good cross-section of partners that are involved. So we have folks from our state agency partners, but also other enrollment assister groups throughout the state, Family Health Center of Marshfield, Partnership Community Health Center, Covering Wisconsin, ABC for Health, and other community partners and stakeholder groups who help to inform a lot of the key message development then that our partners in the marketing work group use. So for example, the feedback around the real importance locally of having that contact information for a local enrollment assister is something that our work group also discussed as a really important way that we could help community partners spread the word in a way that would resonate more locally. We also work to identify and implement strategies to get these tools out to other community partner groups. So for example, identifying key opportunities like partnerships with vaccination sites, and those opportunities when folks are already thinking about their health to spread the word about Badger Care and Medicaid and healthcare.gov enrollment opportunities. But also identifying additional community partner groups that should be engaged in our outreach work and could be supported as community mobilizers to spread this message more locally. And identifying coalitions or kind of scalable statewide opportunities that we might have to connect with partners like that. And then really importantly, we have been actively working with many community partners to tailor that messaging and materials with local contact information. If any of you are involved in this type of work and are interested in getting those outreach cards and flyers that Stephanie just shared, tailored with your local enrollment assistance contact information, please reach out to me. I would love to talk with you and get you some materials, but also talk about other opportunities that we might have to partner together to spread the word locally. We have a couple of examples here on this screen. Our friends at Partnership Community Health Center regularly work with us to tailor materials and to share content like this or messaging like this at other events that they're working on locally. So they are a great partner in sharing materials, for example, at their vaccination pop-ups or in other community events locally where they see an opportunity to share this messaging. We also, as a group, kind of more on the education side of things, do a lot of discussing about important reminders to integrate into all consumer conversations and messaging at different points or key points in our enrollment process timeframes. So for example, although right now, as Stephanie mentioned, it's a key time to talk to folks about open enrollment and coming back to healthcare.gov, we also know that at that time, we connect with many consumers who are eligible and enrolled in Badger Care or Medicaid. So including those reminders about keeping your information, contact information updated with DHS, even while we're doing open enrollment messaging is being so important. And then keeping in mind that there may have been folks who just enrolled during the 2021 special enrollment period, but reminding them that they still need to come back and enroll for the 2022 period and take another look at plans for this upcoming year. So thinking about what are some important educational notes to keep in mind with all of us as organizations involved in this partnership, but that we can also share as we're getting out into the community and talking to other community partners. And then Sarah, do I have time for my next slide or do we need to take a break?
No, I'm going to interrupt you for a minute.
Perfect.
And you can finish your slide in just a second, but we do have a special guest that is joining us who wants to share a message of support for all of your work and some of his thoughts as we head into the open enrollment period here. So just making sure we've got his camera on, and I'm going to welcome Governor Evers to share his thoughts. Thank you so much.
Great, thank you. Am I on, everybody?
Yep, we can hear you. Yep.
Everybody's good? Okay. You always have to make sure these days. Anyway, well, thanks so much for the opportunity to quickly thank all of you. You know, obviously, right now, too many Wisconsinites face barriers accessing healthcare, and whether it's the rising costs that places an enormous financial burden on Wisconsin families, lack of broadband, and which obviously plays a role, limits folks' ability to telehealth services, lack of transportation to get the care they need, or workforce shortages from mental health to caregiving. But thanks to all the partners here today, more and more Wisconsinites are getting healthcare coverage that they need. We started this partnership in DHS and OCI 2 years ago to connect the dots between all the great folks serving everyday Wisconsinites in both agencies, whether agency staff or other healthcare advocates. You know, because of your commitment to this work, this partnership has been very successful. Tens of thousands of Wisconsinites have been able to take advantage of open enrollment because of your coordinated messaging and outreach efforts. This partnership has created great resources like wiscover.com that has helped consumers connect with free expert help. And we want to make sure there are plenty of people available to provide that assistance at the other end of the phone. Especially in the last year and a half, this work has been challenging after we found new ways to connect with each other throughout the pandemic. But this group has stuck with it, asking the big questions, jumping every hurdle, and continuing to ensure that every one of our neighbors can get the high quality, affordable health care they deserve. So as open enrollment begins in a couple short weeks, I know you have a busy fall schedule ahead of you. So we're going to do whatever we can to support your great work. Navigators are critical, so we are looking forward to providing some additional funding to covering Wisconsin in recognition of the added burden of the end of the public health emergency and the end of the pause of Badger Care redeterminations. This funding is intended to enhance outreach, awareness, and available direct enrollment assistance around the state to navigate this transition out of the public health emergency. The transition moment between coverage types is when many people can experience, frankly, an unnecessary and sometimes prolonged insurance gap. This funding will help get the word out that's free, impartial health insurance help is available for Wisconsin residents. So there's just much left to do to make sure that every Wisconsinite can get the high quality care coverage they need. But I have no doubt that this team is up for that challenge. You know, your work has been really important and valuable, any other adjective, over the past 2 years. And I'm excited to see this partnership continue to expand and strengthen in the future so we can build a healthier Wisconsin for everybody. So thanks so much for the short period of time. I know you're busy doing stuff, and thank you for allowing me to thank you. You're doing great work, and you're going to continue to do great work, and hopefully some of the resources we're providing will be of assistance. So take care. Have a great day, folks.
Thank you, Governor.
Thanks. Take care. Bye-bye.
Bye. All right. Well, I'm going to hand it back to Courtney then to kind of pick up where she left off, but hopefully with a little more, with that support from the governor, helps everybody feel very supported during the next few weeks of the crazy open enrollment period. And yeah, a big part of that is going to be just that executing on the outreach plan that this group has put together. So I will go back to Courtney to finish her presentation on that.
Thanks, Sarah. Yeah, absolutely no pressure or challenge at all to follow the governors. Thanks. Glad I have the last half of my update. But anyway, my next slide was about kind of our future planning and the outreach strategy that our group is starting to put together around the end of the public health emergency, which will absolutely be informed and impacted by any additional funding support that we might have available to support those efforts. So very exciting to hear about that. In that vein, our work group has been and will continue to, over the next several months, develop recommendations for our state agency partners on ways that they can help support our outreach work throughout the state when it comes to the public health emergency and the transitions that consumers will be experiencing at the end of the public health emergency. But we also are working on an outreach strategy. So some focus areas of those recommendations that we've made so far include obviously working very closely with our data work group partners. So much of the work that Melissa shared earlier, we're continuing to support their efforts to share data with community partners through this partnership and beyond, to support our work and help to plan for and prioritize our outreach activities throughout the state. We also are working on identifying opportunities for inReach for community partners who work with consumers directly, planning using the data work group and their models to support additional direct outreach efforts that some of our organizations are able to engage in because of data use agreements with the state agency, and planning to support existing and new community partners that we build relationships with and can support as mobilizers to help spread the word throughout the state at the end of the public health emergency. So identifying key messages, creating materials, and sharing those resources with community partners throughout the state and training them on how to help spread the word locally as trusted community partners. And then, of course, just emphasizing the importance of coordination across all of us as stakeholders and community partners to ensure that we have some efficiency, but also avoid any consumer confusion. For example, discussing how processes like the warm transfer that we discussed with 211 that we work with through Covering Wisconsin to have in place during the open enrollment periods, how a process similar to that might work between other community groups that are assisting consumers and enrollment assisters at the end of the public health emergency. So obviously, as community partners that are out in the community and hearing from consumers and working directly with consumers, your input on this, our public health emergency unwinding effort, but also open enrollment activities this year and in the future are extremely important. So if you have ideas, if you want to share what you're hearing from the community that will help inform our outreach strategies and recommendations, please do reach out to me. Even if you're not able to commit to participating in the work group regularly, we would still love to hear from you. So my email address is on the screen and I can also share it in the chat. With that, I'm going to take it away for myself.
And if I could just cut in, thank you, Courtney, for that. And I also want to say, as the director of Covering Wisconsin, that we're thrilled with this news. And I wish I could have said thank you directly to the governor after his announcement, but I know he had to go. And we will be working very quickly to take back many of the recommendations that have been brought forward through these various work groups that we've been discussing both here and really closely over the past several weeks to think about how can we, as a community, as a state, as individual stakeholders and working together, really work together to help with the public health emergency unwinding. So more to come, very excited, and again, thrilled that we have this opportunity. So thank you.
Thank you, Allison. All right, well, we are a little bit short on the discussion period that we plan to have at the end of this meeting, but I think having the last presentation be on outreach and education seems appropriate. I think that's a great place for many of the stakeholders on this call to potentially provide their feedback, ideas, and insights. So I haven't seen any questions or comments come in on the chat, but if you do have something you'd like to make sure that a work group chair knows about, or if you just want to share some of your thoughts on what you've heard today, please let me know in the chat that you'd like to share a comment or ask a question of somebody, and we will discuss that. And I'm just going to pull up the final slide so everyone has this on their calendar as well. I don't see any questions coming in. So I know a number of different folks from the work groups have put their contact information in the chat. So if you do have thoughts, if you have questions, if you want to get involved in a work group, please reach out to them, let them know. And we do have our next quarterly meeting with the large forum on Monday, January 24th, 2 to 3:15 p.m. That we will do a similar type of thing, but of course it will be about 10 days after open enrollment period ends. So, oh, we do have a comment here. So I think this is probably through Courtney. Is there any community outreach through public schools or discussion of that?
Yes, definitely. We discuss that regularly as a group, as a work group. And I know some individual members of the work group do some specific outreach for families, specifically around back to school events in areas throughout the state. We haven't had great success yet in connecting on a statewide level through DPI to do some more kind of statewide school specific outreach, but that's an opportunity that we've discussed as a work group for some time and are actively continuing to pursue and interested in. So if you do have some ideas that you'd like to share with me directly or some contacts that you would recommend, please do shoot me an email. I would love to talk more, Michael.
And Michael, feel free to unmute yourself too if you have anything to add during this discussion too. Always looking for those ideas. So if there are other ideas that you have to connect to a community you serve or any of those things, we'd love to hear them. All right. Don't see any other questions coming into the chat. So we maybe can end a minute or two early here. Again, I hope to see you all at our next full partnership forum in January. And I wish everyone a great open enrollment period, November 1st. It's almost here. And other than that, I hope everyone has a good Monday afternoon and appreciate all of your time today and all of your work in this partnership. All right,
Thank you.
Thank you all.
Thank you.
Bye.